and welcome to all our viewers from around the world. I'm Kristen Schwartz, licensed midwife and one of the MCs here at Gold and Gold Midwifery. And with me today is one of our speakers for the upcoming Gold Midwifery online conference of 2022. And I have Maya Bolman here with me. Maya, welcome.
Thank you. Thank you very much for having me.
It's lovely to have you here, and we're so honored to have you here and you speaking for us at the Midwifery Conference. I know you have a very broad background in lactation. You're very well known in the field of lactation and anything with regards to breast and chest feeding. And we love to have you this year at the Midwifery Conference as well, because of course, midwives, birth workers need to, of course, learn about, get all the information we can about lactation, how we can help our families be of service to them antenatally and of course, especially after birth. Tell us a little bit about yourself. Where are you? Where in the world are you? And tell us about your background.
So I live in Cleveland, Ohio. This is right on a big lake area. So it's really winter right now here. But I was born and raised in Minsk, Belarus, which was part of Soviet Union back many years ago. My background back in Russia, back in the Soviet Union, I was actually a musician by training.
Oh.
My major was orchestra conducting, and I played in orchestra for over 14 years.
Oh my goodness, how exciting. How
so
wonderful.
I guess musician hands really helpful with many manual techniques. And since we came and we immigrated to United States, I got my nursing degree, and then I loved working in OB, postpartum unit. And gradually I got my IBCLC in 2001. And then since 2001, I've been working in this field as lactation consultant. I have 26 years working in a hospital. 24 of them was at postpartum unit. And for the last 13 years, I also work at Breastfeeding Medicine of Northeast Ohio, which is a breastfeeding medicine practice. And I also, in the process, I do have my own private practice and just founded this Breast Kindness LLC. So that's my background in all of this.
Beautiful. Tell us a little about, you just said you just founded Breast, the last company, Breast Kindness, is it called?
Breast Kindness.
Yeah, tell us about that, because that's a brand new thing, right?
It's a brand new thing. This is just a few days old.
Wow.
I've been asked for many times, where's my website? And I'm probably from that generation that the IT world is not coming easy to me, but gradually with help of my kids, we're developing website. It's gonna go live probably in a few days from now on. And the name is Breast Kindness, one word. And that because it's basically, that's what my old techniques are. They gentle, manual, therapeutic techniques in lactation, things that you empower parents to do to help themselves, and they are very gentle and kind.
Oh, beautiful. Yeah, I love that name, Breast Kindness, and how you describe it, gentle and kind. That sounds absolutely beautiful. I love also how you describe that you're teaching parents, because for me, I find it just, they're the experts, right, on their body, on their babies, and to giving them the tools they can, so they are in charge as well. Of course, as professionals, we want to be there, we want to help them. But I think for myself, there's nothing better to see that they can do it, that they feel confident in their bodies, in their techniques, in their skills, right?
Absolutely. And, I have a very special story going back to Soviet Union. My great aunt was a midwife, and she was so famous in our cities that at the age of 12, I really did not know what she was doing, but I saw all these women coming in her apartment crying, and then they living smiling and happy, and they want to move in with her. When I had my first one, I did realize that what she was doing, actually, she was doing breast massage and helping them to resolve plugged ducts, mastitis, and engorgement. And since then, she learned I learned those techniques from her, and then I would think probably took them to the next level of doing research behind them, describing them more. But that connection, and that's her kind hands back
Oh,
then, coming from
oh,
that midwifery background, I think that
how
it just
beautiful.
probably meant to be.
Yes, how beautiful how you honor your grandmother's work and continue it and teach it to others and develop it further with research, with your own techniques. How lovely is that? That's
Yep, I
how
always say she's
beautiful.
smiling from above.
Yes, and she probably is, and being very proud of you as well that you're continuing this amazing work and helping all these families and babies, and that's what it's all about, right? Helping
Mhm.
the little ones. So for your presentation here at Gold, your presentation is titled "Our Hands," and that's exactly it. Our hands as tools to resolve acute breast pain in the early postpartum period. So walk us through a little bit about what you will be talking about.
So I will talk a little bit about history of breast massage. The breast massage is not something I invented or
Mhm.
invented somebody in the modern times. It's been in every culture for thousands probably of years. And there are so many women that are skillful. And then, of course, there is a massage that is not kind, is not
Mhm.
gentle. And we need to be able to differentiate and learn the techniques that work. I think it's also it's very simple. We don't need sometimes overcomplicate, but knowing the lymphatic system of the body, knowing
Mhm.
the pain control of the body, knowing how hormones work, you can help with the hands without really intervening with some kind of instruments, or it can be as easy. And then many times it can be done even this telehealth learning, like you talk to your patient over the phone or over the telehealth platform, and you teach them those techniques. And I
Mhm.
get thousands of responses from mothers. I could not believe how simple it was. I could not believe that I did it myself. It was so empowering. And then hearing from midwives and
Mhm.
hearing from lactation consultants all over the world, I was skeptical at first, but you know what? This just works. Again, very simple.
Very simple, but very effective. It sounds
Mhm.
absolutely wonderful. And oh my goodness, I can't wait for your presentation. And, you are so right. Midwives are there and birth workers are there, right? Prenatally and, of course, during birth and then coming back for postpartum visits and being there. So teaching midwife and birth workers these techniques and that they can teach their clients and their families is important, especially I feel always the work that is done before the baby is born is also essential. The education, is there anything that we can be taught prenatally with regards to these techniques?
Absolutely. Antenatal hand expression becoming more and more popular. The breast massage or my techniques that I describe, breast gymnastics, can be helping with alleviating premenstrual pain,
Oh.
postmenopausal pain. I think that the breast is one of the organs that doesn't move on its own.
Mhm.
So there are many problems coming just from that not movement. Movement is actually life, what I believe. And if we don't move, literally and figuratively, then we don't really do well. So
Mhm.
the same goes with the breast. And then there are some things that make it worse and some things that make it better. And my goal is actually, and that's why I think Gold is such a great platform, because we need to stop to treat, for example, swelling and inflammation with creating more swelling and inflammation. And I'm going to give you those the really instructions, directions, or suggestions in my presentation. But unless we change this altogether, we will not go very far with
Mhm.
resolving those painful situations.
Well, Maya, it sounds absolutely fabulous. I can't wait for your presentation. I'm
Thank
very
you.
eager to learn more about this, and you have amazing videos during your presentation where you really show how it's done, what it should look like, what's going on, and describing it. So it will be a very educational time here, a presentation and a lesson that you will be teaching us. So I am really looking forward to it.
Thank you. We'll see you in February.
Exactly. We'll see you in February. And this is now for our viewers. If you would like to find out more about this presentation that will be live during the Gold Midwifery online conference here, that presentation will be live on February 8th. The conference gets started on February 1st. And if you would like to find out more about all the presentations and the times, live times, we invite you to visit goldmidwifery.com. And if you can't make it live, that's okay, because all the presentations are recorded so you can watch them at your leisure. Thank you again, Maya, for spending
Thank
time
you.
here with me today. And thank
Thank
you
you.
to all our viewers. And I hope to see you all at the conference. Bye-bye, everyone.
Bye.